Good day guys, in this video we will speak about the menstrual cycle. So this is Dr. Rahul Isam here. I will take you through the whole topic. So starting with the introduction of menstrual cycle, menstrual cycle is nothing but the regular changes in the ovary and endometrium to make the reproduction possible. So we speak about the regular changes which happens in the female reproductive organ, so-called uterus, the ovary and the fallopian tubes. So during the whole life. So this menstrual cycle recurs on the monthly basis. So it starts with the menarche. Menarche is called as the first period, which occurs at early adolescence. As puberty. So this menstrual cycle pauses during pregnancy. And it continues until menopause. And also there are two interconnected and synchronized process which is happening. The one is ovarian cycle. So in ovarian cycle it's regulated by the hormones from pituitary gland, the hormones secreted by pituitary gland. So this ovarian cycle is responsible for the development of follicle and ovulation. And next comes the uterine cycle. These are the changes which happens in the uterus. So here the hormones are regulated by the hormones are regulated from the ovary during ovarian cycle. So in uterine cycle, the functional endometrium thickens and shreds in response to ovulation activity. So this menstrual cycle consists of two phases. Number one is the follicular phase. From the day 0 to day 14. And then comes the luteal phase. From day 14 to day 28. So speaking about the follicular phase, it is from the first day till 14th day before LH surge. So in follicular phase, the growth of follicle speeds up. During the second week of this phase. So then the luteal phase, this is the phase from the day of ovulation. From the day of the LH surge until the beginning of next menses. So now speaking about the hormones which are responsible, we'll start with the hypothalamus. As we know already, the GnRH is secreted by the hypothalamus. So this GnRH stimulates the anterior pituitary gland to secrete the follicle stimulating hormone as well as luteinizing hormone. And this is responsible for the production of hormones such as estrogen and progesterone. in the female reproductive organs. So we're speaking about the menstrual cycle. There are some points which we got to remember. So the females are born with millions of follicles, around 6 to 7 millions, called as the primordial follicle. So at 20 weeks of intrauterine life. So when they are born, it changes to 1 to 2 millions. So that reduces to 3 to 4 lakhs during puberty. So these primordial follicles are either cuboidal or columnar, and they have around 1 to 2 layers of cubic cells, and they are bright red like scarlet covering. So this, among these 3 to 4 lakhs, around 400 to 450 follicles are utilized in a woman's life. So at the time of puberty, the GnRH is secreted in pulsatile fashion. So the lot of GnRH is produced. So with the help of FSH, this primordial follicles, they get converted into primary follicle, and then this primary follicle converts into secondary follicle. So this secondary follicle contains cells called as the theca cells, the theca cells of ovary. So this theca cells secrete a hormone called estrogen. And also before that, we got to understand that all these follicles are surrounded by cells called granulosa cells. So these granulosa cells are responsible for the production of a hormone called estrogen. And also when the secondary follicle develop, the theca cells secrete estrogen. And also the theca cells secrete a hormone called as the androgen. So this androgen, with the help of aromatase enzyme, gets converted into estrogen. And the secondary follicle contains a layer called as the zona pellucida. So this zona pellucida is responsible for two functions in order to prevent the ectopic pregnancy, and it's also responsible for the multi-sperm action, so that only one sperm is entered into the ovary. So and then this secondary follicle is converted into tertiary, or called as the Graafian follicle, which is the mature follicle. So once the Graafian follicle is produced, it enters into the phase called as the luteinizing phase or the luteal phase. So in luteal phase, this Graafian follicle converts into oocyte. So this oocyte is covered by, or the Graafian follicle is covered by corona radiata, and it floats in follicular liquid. So that it moves to the surface of ovary. So now we studied about the release of oocyte when it enters the luteal phase. So now we'll consider about two situations or two circumstances, where the first circumstances is when the woman gets pregnant, and the second circumstances is when the woman is not fertilized. So we'll speak about the first case, where the woman gets fertilized after the production of oocyte. So we'll speak about the changes happening. So before that, we got to understand some points, that the life of a oocyte is only up to 24 to 48 hours. So the oocyte dies after 48 hours. So what happens is, when the sperm reaches the oocyte, so the sperm reaches oocyte in ampulla. And then once they are fertilized, the embryo reaches the uterine cavity on the third or the fourth day of ovulation. Ovulation is the day when the oocyte is produced. So, and then the progesterone is released. So this progesterone is released by a certain substance called as the corpus luteum. So this corpus luteum is actually the remnant of the Graafian follicle. So it's actually the remains of Graafian follicle when the oocyte is released. So this corpus luteum secretes progesterone, and it prepares the endometrium for implantation and it results in the hyperplasia of the endometrium. So this hyperplasia of endometrium is done by estrogen. So the progesterone is responsible for the secretory endometrium, and the estrogen is responsible for the proliferatory endometrium. So the second condition is where when the women not get pregnant. So we'll speak about the changes that are happening when the woman is not fertilized. So the second condition, where woman is not fertilized. So when the woman is not fertilized, the oocyte dies in 24 to 48 hours. So this corpus luteum degenerates. So the corpus luteum degenerates at 9th or 10th day. So the complete degeneration happens at 14th to 15th day. So this corpus luteum degenerates to form a substance called as the corpus albicans, and then it results in shedding of endometrium. So it results in progesterone withdrawal, because corpus luteum is responsible for the secretion of progesterone. So along with the components, along with the remnants of the endometrium, the shed endometrium, the uterine contractions expels the menstrual blood along with the endometrium. The proliferated endometrium, the remains. So that causes a pain called as dysmenorrhea, which is called as the menstrual pain. So we'll speak about the dysmenorrhea precisely in the upcoming videos. So this is the summary of menstrual cycle. I hope you guys have understood. And we'll speak about some important points in menstrual cycle. Number one is the menstrual cycle lasts for 24 to 35 days, but the average is 28 days. And the menses, which is nothing but the bleeding we are speaking about, that lasts for around 3 to 7 days. And the average blood loss is around 35 to 50 ml. And also there's a circumstance when the average blood loss reaches 80 milliliters, so that is when it is called as polymenorrhagia, where there is excessive blood loss. So this polymenorrhagia lasts for less than 21 days. So when the patient has, or when the female has polymenorrhagia, so the menstrual cycle lasts for less than 21 days because of excessive blood loss. And also there is a condition called metorrhagia, where there are irregular cycles superimposed on regular cycles. So the women will have regular menstrual cycle and also irregular cycle. So this is called as the intermenstrual bleeding. So in absence of pregnancy, there is a decreased secretion of progesterone. So that is responsible for apoptosis of functional layer of endometrium, as we discussed. And that in turn results in menstruation. So I hope you guys are clear about the menstrual cycle. I'll give a heads up on the next video. Thank you.